let's talk about hips, and actually let's talk about hip surgery, hip replacement surgery. So I was out in the water this morning and saw one of the locals, known this guy for years and years and years, and for a couple years we've actually just in the water been talking about his hip. And so he's actually getting a hip replacement surgery. And this is a great example of, I want to talk about three different things of how to, if you have to get a hip replacement surgery, what are three things that are going to help you be as successful as possible and getting you back to your activities. Okay, so three different things. So number one, surgeon selection. So what was great about what he's done is he just didn't go with who was, at the local hospital. He actually interviewed and searched for different surgeons, finding out their reputation, finding out what their outcomes are like, particularly when it involves infection. Because if you get an infection in a joint replacement, you're looking at a world of trouble. Antibiotics, potentially having to have another surgery done. It just becomes something that's very complicated, and it can just frankly be a nightmare. So he actually selected someone who is more of an independent surgeon who actually uses robotics with some of his surgeries. So someone who's on the younger side coming out of medical school and their residency and fellowship, utilizing newer technologies. And I say that because what you will find, particularly when it comes to technicians who are surgeons, that a lot of people stick with what they learned in their residency and fellowship and don't really progress past that. So again, rather than going with an older surgeon, he decided to go with someone who was younger, didn't have as many years of experience, but is coming out of residency and fellowship with newer tools and being able to utilize those tools. Okay, so number one was surgeon selection. Number two, you need to go into your surgery being as in the best shape as possible, because the better shape you go into your surgery, the better recovery you're going to have. And when you need to do your physical therapy, the faster response you are also going to have, which means that you're going to get back to your activities faster. Whether that's surfing, whether that's skiing, whether that's walking, could be gardening, whatever it is, you're going to be able to get back faster. Now I want to add a caveat here, is you want to also make sure that you're not pushing it too fast. You do want to listen to your post-operative instructions. So the big things are, you're going to have a scar, and you need to make sure that at least for the first 10 to 14 days, you do not get in a pool, a hot tub, the ocean. You're not exposing that scar to water or to other environments that can actually cause an infection, because again, you just don't want to have an infection anywhere near where you've had surgery. And then you want to be able to progress in physical therapy, but you don't want to go too fast, because you could actually harm yourself. You could set yourself back. You could actually do something that's detrimental to the new replacement that you've had. Okay, so just keep that in mind. Number three, you need to make sure that if things aren't going according to plan, you speak up, you work with your physical therapist, and if that isn't working, then you need to find someone else. You need to work with someone who is going to help you get back to where you need to be. So what might some of this be as far as like that you've run into trouble? It could be that your glutes are shut off. that the glute that you have on, let's say you had surgery on your left hip, that your left glute is just not back online anymore. So you need to awaken that. There is something called glute amnesia. It could be that your quad is painful, is stiff, that you're having trouble, you're able to move, but you're just having trouble with that particular muscle. So, what does this mean? It could mean that you're working with a physical therapist. It could mean that you're working with a body worker. It could mean that you're working with an acupuncturist. But you need to work with someone who's going to help get your muscles and these muscle groups working together again, communicating with your brain so that you are moving efficiently and you're moving in the way that you should be, that you're not compensating anymore. Because oftentimes what happens with months or years of being in pain and walking differently, you actually have compensated so much that that becomes your default movement. And once you have the hip replacement, you want to move as freely and as naturally as possible, and you want to shed or get rid of those old compensating movement patterns. And you might need help with some regenerative medicine. That could be something like peptides. It could be certain injections. It could be injections for trigger points. It could be injections around some of the muscles or the ligaments or the tendons. I wouldn't suggest any injections going anywhere near the joint, but as far as the soft tissues that are around, if you need help with those, then some of the regenerative injections can be very helpful. All right, so those are 3 things that you should be paying attention to and looking for if you do need to have a hip replacement surgery. All right, like and subscribe. Share this with anyone you know that is getting a hip replacement or has received one recently and they're going through the recovery. And I'll see you in the next video. All right, thanks, bye.